but mentally I feel better. Emotionally, I feel better. And there's something that happens. There's a community of people here that also really care about wanting you to get better. I don't want to leave. And then when I recently found out that I needed to get my knee replaced, I was really miserable, a lot of pain, feeling hopeless, like when am I going to get it replaced? Nothing's going to help. And when I reached out to Dr. Lynn to say that I needed to start physical therapy, I talked about it and then kind of dug the hole that we were talking about, like where I was just like, oh, okay, when do I start? What do I do? Is it worth it? And then he continued to reach out to me to say, where are you? Because I was digging a hole, not coming out of it, because I felt hopeless. Like, I was in pain. So I have a yoga practice that I haven't been doing for a while. And he remembered that from the last time and said, these are the things you want to get back to. We got to get you there. And thankfully, they were very patient with me. They didn't give up on my continuous digging. And I've been coming now for, I think it's a good couple months. And I definitely feel better. Not just physically, my pain has improved with my knee, but mentally, I feel better. Emotionally, I feel better. And there's something that happens. There's a community of people here that also really care about wanting you to get better. You connect with the other people, the other patients, and it's something that overall really just promotes you into feeling better, reminding you that you're not alone. You're not the only person that gets into these places. And thankfully, there are places like Empowerment Physical Therapy that are there to reach out to you and help you when you're in these dark places. So even when you're feeling hopeless, there's people that are helping you to remind you that you don't have to be hopeless and are patient in letting you carry on with your journey. And once you start that journey, it's a beautiful thing. I don't want to leave.
What would you tell someone who is in a similar position as you are, who is stuck, have been given a diagnosis that they're probably not very pleased with, and sort of is in a little bit of denial initially, which is like a lot of case with such a big diagnosis, and then they kind of procrastinate and kind of kick things down the can. What would you advise?
The hardest thing when you're in a hole is trying to find your way out, but just instead of looking at the bigger picture or where the journey is going to go, just taking that first step, even just making a phone call and talking about it. And again, getting that personal attention where they're going to understand what's going on with your unique experience, how it's affecting you. And just that call, making that contact to hear that there's an option and a possibility to move forward, even when your own thoughts are keeping you in a dark place or physically you feel like you can't, just making that a phone call, I think, to discuss your options.
And what does life look like for Desiree now, looking back at three a couple months from now? What are you what does that look like for you in terms of your life outside of here and what you've been able to do?
Significantly different. And it sounds, again, I feel like it sounds cliche, or like can it possibly be? But it really made a huge difference. I don't have as much pain as I did. When I was at work, my knee would lock. I would be more irritable, even at home. I feel physically better. I feel emotionally better. And, I'm little by little, I'm doing things. I hung curtains up in the apartment. Like, that was pretty significant to be able to get up and down, a step ladder. I didn't think that is not something I could have done a few months ago. And if I stayed in a hole and I ignored trying to go forward with a journey, then I would still be stuck in a dark hole, miserable with pain, and just feeling like emotionally hopeless and drained, because pain in itself is a drain. And then that emotional aspect when when it's dragging you down also drains you.
How's it impacted your role at work as a nurse, given that you're in the health care space as well?
I think it's funny. Even my coworkers have noticed, like, again, I think it's number one, I don't feel as exhausted because the pain is getting better. I feel like I'm getting stronger. So I feel energy-wise that I'm more I don't know what the best, I don't want to say energized. I feel like I'm using the same word, but I definitely feel more motivated to move forward with my day. I don't feel like I'm being dragged down by the pain, by the negative emotions. And I don't feel like it's as effortful to do things because I'm not feeling as sad, discouraged, hopeless, and in as much pain. So that's both at work and on the home front, you know?
Your mom see that.
Yes, it was funny. And that's the other thing, the holistic approach where they recognize everything. I helped take care of my mom, and I was by myself one day and I was pulling her, and I pulled the right side of my back and I said, Mom, I'm going to physical therapy. I complained. I said, I just pulled my back. She said, let them know. And it's true. I came and I told them and I left feeling better. So, like, but she knows directly how much this affects me in a positive way. And that's a good thing for me and for the people that I work with, for my family, you know. So it definitely is a ripple of a positive effect.
Have you gotten back to yoga?
Okay, so that is my time wise. I definitely feel like I can get back to yoga. It's just that I'm sort of transitioning with some caregivers for my mom. So time wise, I've been prioritizing, if I have time, to continue my physical therapy. But once those other things kind of iron out at home, I didn't even think my yoga practice would be like an option for me. I was so discouraged, but I definitely feel like it is a possibility for me. So now it's just a matter of like allotting my time for it,
That's awesome. That's awesome.
which is also available here, yoga. I learned that when I came back, you know?
Absolutely, and that's one of the reasons why some of our patients kind of have taken advantage of that. And folks who do yoga we didn't know they do yoga until we kind of offered that. They're like, I love to do yoga. I've been doing yoga. And I would love to kind of come here on the days on that I'm not coming for a PT, so I can keep that window of improvement open and kind of continue to kind of work on those postures, those breath works,
Mm.
because they sort of complement the stuff that you do in the treatment room. Sort of no doubt about that.
And you knew how significant my yoga practice was to me when I reached out to you and I asked about it and I said, I don't have a yoga practice anymore. And you said, we got to get you back to that because it affects me just like physical therapy has affected me positively. My yoga affects me positively. And I can't do one without this step, you know?
Is there anything that what would life look like if you didn't start this journey 3 months ago?
If I was in a hole and I reached out to you and then kept digging, I can't imagine like where I would be. Like I would be far more miserable. I'm sure physically I wouldn't be feeling any better. I'm only feeling better because I've been coming here and strengthening things. There's nothing I can do about the actual problem itself, but strengthening all the muscles around it so that I can feel better and better support myself. And that's kind of powerful in itself when you think about it, you know? And you feel it. I feel it. That's the thing. Not only because it's alleviating the pain, but just because I can feel it. And I remember one time joking with Dr. Lynn, like I feel like I get in shape when I come to physical therapy, you know? So, I can't imagine, I wouldn't want to think about it. When I was in that hole, I couldn't think of anything positive. And it's interesting for you to ask me what I think my life would look like if I hadn't come to physical therapy. That would not be a good thing because I was not in a good place before I came, and it certainly wasn't going to get any better if I didn't do anything differently.
Was this worth the investment?
Oh my God. And there's no other place that I would want to return to physical therapy. When I came a few years ago for a different problem, initially when I got the diagnosis, I immediately reached out to Dr. Lynn and then, you know, was digging my hole and he knew what I was doing, but I certainly can't see myself reaching out in any other direction than here. Like it affects me significantly. And I feel like there's like a personal level of care, which sometimes is lacking in healthcare overall. It's a holistic approach, the community aspect. So for me, like there really isn't another option.
What do you tell someone who's been let down in the past by another clinic?
It's hard. You easy again. It's like digging the hole, giving up, throwing the baby out with the bathwater, thinking that all things are going to be the same. And this place is truly, truly unique. I remember saying that to you from early on in my experience. And I started with you, and now Dr. M is here, and I've worked more closely with her this round. And one of the most eye-opening different experiences with her was in most of the physical therapy that I've had in the past. People are always saying, you're okay, you're doing okay, and not really acknowledging that maybe some of the things that you're doing are not feeling okay, and maybe, dare you say the word painful. And so she saw my face during one thing. She's like, you having some pain doing that? Like, and acknowledging that this wasn't such a good thing for me. And that was a real moment, like, of recognizing that, the journey kind of takes its course and you're going to be feeling feelings along the way, and all of them are okay. But there's a very big connectedness with your therapist to recognize how you're feeling, what you're doing, and your progress, along the way.
What have you learned about yourself through this journey thus far?
Okay, well, I didn't even want to do this interview. And that, like, I was like, this is not my thing. I don't like really being like in full view. But it was, I think for me, it was having a discussion with you about it and recognizing that other people feel the same way that I do. And if I don't share my story, then other people might not feel like there's a possibility for them either. So it would be selfish to not share my story and how much empowerment physical therapy has helped me, because I would want other people to have that same experience and to know that it's a possibility for them also, and that they're not alone and unique in what they're feeling.
Thank you. Appreciate that.
Thank you. Yay!